Hi.
Hello.
Hello.
Hello. Well, welcome. Welcome. I hope you guys enjoyed the opening session. I unfortunately missed it because I was getting ready for this, but it sounded really interesting. We've got a nice small group here this morning, which I think is perfect for solutions and brainstorming. So really looking forward to that. For those of you who don't know me, I'm Rosie Cunningham and I work for Family Reach, and we are a national organization that is laser focused on addressing the financial burden of cancer. So I'm really excited to have the chance to guide us through a conversation today focused on how we might create new models to deliver effective financial support to patients and their families. Before we kick off, I wanted to start with just a few ground rules. This is a solution session, which means we're brainstorming and we're trying to solve a really complex problem, and that requires thinking outside of the box. So let's throw out best practices, throw out that's never been done, or this is why we couldn't do it. We really want to empower ourselves to just think creatively so that we can come up with the best ideas. With that in mind, no idea is a bad idea, no idea is too crazy. And our success today is really dependent on everybody's participation. We want to hear from as many diverse perspectives as possible. Your experiences, what you know, what you're hoping we can accomplish together. So I hope everyone feels comfortable participating. And to do that, raise your hand, jump in, interrupt me, and you can also use the chat feature, which I think we have KK from Livestrong is monitoring that, and I'll be peeking at it too. So feel free to use the chat, but I do hope you'll participate today. I think you guys, because we have such a small group, it might be nice if we went around and just introduced ourselves, if everybody's okay with that. So I've already started, and I'll guide us through just based on the order I see on my screen here. Pamela, would you mind introducing yourself?
Absolutely. I am in Austin, Texas, and I work for Big Love Cancer Care, the Director of Operations for our hospitals here in Austin and San Antonio.
Great, thank you. Patricia.
Hi, Patricia Gallagher from Garfield, New Jersey. And I run a YMCA, and we just started running with the Cancer Survivor Program last year. And now with the pandemic, we kind of took a little hiatus and kind of looking for some new ideas to kind of relaunch and restart our program back up again.
Great, thank you, Patricia. Carly?
Good morning. I'm Carly Triola, and I'm a marketing manager here at Livestrong. So I'm happy to see all of you, and I look forward to the session.
Awesome. Michael?
Hi, I'm Michael Kittner, and I'm a development manager here at Livestrong. I work in events and fundraising, and excited to learn new and innovative solutions to help the constituents that we serve.
Thank you, Michael. Greg?
Hi there. My name's Greg Boone. I'm a general surgeon who focuses on breast cancer care, and I'm also a cancer survivor, and I've been a volunteer with Livestrong for a long time. I have a lot of indigent patients in my practice, so this is something that hits home for me, and finding ways to help them is really important.
Wonderful. And finally, Tracy.
Hi, I'm Tracy. I also work for Livestrong. I'm their VP of Finance, and I'm just excited to learn and talk with you guys about possible solutions.
Awesome. Well, thank you guys. I wasn't intending to do that, but with a group this small, it feels nice. We can at least know who we're talking to, so thank you. Well, I want to spend the next 10 minutes or so really kind of digging into our guiding question, which is, can we create new models for effective direct financial support for cancer patients? And by digging into this question, what I'd like to do is establish really a collective definition between this group on what we mean by direct financial support, and then start to identify some of the barriers that currently exist. So as we transition into solutions, we're really focused on what are the hurdles that we need to overcome as we develop new ideas. So let's start by aligning on that definition. What is direct financial support in the context of this conversation? For us at Family Reach, direct financial support has historically meant we are sending direct emergency funding to patients so that they can cover non-medical expenses like housing, car payments, transportation, childcare, things as simple as keeping food on the table. So that's the lens I'm bringing to this conversation, but I know there's many different forms of direct financial assistance, financial support. So would love to hear from you guys how else you define financial support for cancer patients.
Yeah, that's how I would define it. I think that, you know, and I've seen it firsthand where people, you know, the amount of stress is just as bad, you know, pertaining to, you know, your livelihood. And so, you know, the more that we can take that stress off their shoulders, I think that that could also give them a fighting chance to really focus on the urgency of you know, going through treatment. So yes, that's how I would define it.
Great, thank you, Tracy.
I agree with what was just said. One of the things that I find for my patients is that they sometimes miss appointments for chemo or radiation or with me because they can't get to the appointment. They don't have transportation. They can't afford the bus. They can't afford a taxi. So that's an issue that I see on an everyday basis that really, you know, it seems something simple, but it ruins everything if they can't get there.
Absolutely.
I agree as well. I mean, this is what we do every day. I was just on the phone all day yesterday providing financial support for different families. And so I'm excited to hear some new and different ways.
Great. Anybody else? Okay. Well, let's move on and start talking about some of the barriers that we're currently facing as it relates to delivering this direct financial assistance. I think kind of if we can ground ourselves in a few primary barriers that we want to focus on, that will help us as we develop solutions together. So what are some of the barriers that currently exist? And Pamela, I'd be eager to hear from you as you're in this work every day on where are the primary challenges, both for you as an organization, also for the families and patients. I think we've already identified transportation as a major barrier. But for us organizationally and kind of as a system of healthcare providers and nonprofits who are in this space, what are our preliminary barriers to doing this work effectively?
Several. You know, I mean, right now, obviously, donor retention and donor giving is down due to COVID and due to a lack of in-person ways for us to connect. We're all about relationship building. And as much as, you know, Zoom has provided that gateway, we still just have noticed just the lack of being able to be in front of people and really share our mission and our heart of serving families has affected us directly. As far as families, I think just the initial request is sometimes hard, especially if they feel like they're already getting too much support. They don't want to take away from other families. Some of the most humble people I've met are the families that we work with day in and day out. And so just really, again, building a relationship with them that we're here to help, we're here to support. They do have a network that they can lean into of unknown people. It's sometimes scary for them to say, here I am being very vulnerable, that this is our need. And so really, you know, just stepping into that space and saying, here's what we can offer, or at least letting them ask us. You know, we always say, yeah, it might be a big ask, but ask it. And then I am here to do the legwork for you of getting that, you know, fulfilled. And yeah, so that's, I guess, where I would start.
That's great. And oh,
Can
sorry.
I jump in?
Please.
One of my frustrations as a provider is that even in my relatively small community of Canton, Ohio, every day it seems I find out about someone else who's doing some work that would help my patients. But I mean, I've been here for 11 years and I still don't know. And so that's one thing I think that there are a lot of organizations that do good work in the community that those of us who are direct care providers are unaware of. And so finding some way to make us more aware of what's available for our patients would help. The other thing that just standing back and looking at the big picture, and this has been a little bit of a frustration for me through the years because I volunteer with Livestrong, but I've also been on the board of Komen here in Northeast Ohio, and I work with Emmerman Angels and other organizations and try to support as many of these as I can. But I see a lot of kind of duplication and competition amongst the nonprofits and the organizations doing the work in the community. And it's always struck me that there's got to be some way to bring all of these people together, have them have some, and I think we're doing it today, but have some conversations about how can we look at what we're trying to provide for the patient and the people who are going through their cancer care survivorship, and how can we take the best of what each of us do and focus, you know, those in a cooperative fashion. It just seems to me like we compete a lot with one another when our goal is the same. And I think there's got to be a better way to do this.
Absolutely. Completely agree, Greg. Thank you for that. Anybody else with barriers?
Well, I've experienced the vulnerability was really hard with even my own family member going through it. Like I didn't know to the extent until she passed away on how she was suffering financially. And, you know, just if there's a way we can even connect with our family member without them having to feel like they can't ask. And also another to what Greg just mentioned was that, you know, there's a lot of competition. And so in the financial world, when the more you have in one bucket, the more likely you're able to get a return. And so working together could actually be a benefit for everyone rather than competing and trying to say, well, this was done in my name and when it should be done in all of our names.
I love that. One thing that I've been thinking a lot about is kind of how is doing financial assistance enough? You know, is paying a patient's mortgage enough? And we did a survey recently of our constituents who we've supported, and we saw that 70% of patients were still reporting pretty intense financial distress even after receiving our financial assistance. And so we're thinking a lot about how to transition from a Band-Aid approach to a longer term approach. So that to me feels like a big barrier, is making sure that as we streamline this, as we learn how to work together, how do we make sure that we're not just a flash in the pan for families and patients, and that our interventions can really influence their financial health throughout their journey.
Of course, one of the big issues that's more global, I think, is the fact that we just have so many people who don't have health care and who have limits on their health care And we all know, since we work in the cancer world, that one cancer diagnosis can wipe out a family completely. It can take all of their insurance coverage and all of their resources that they've saved and worked for, and just eliminate them in a year. Everything can be gone. And so on a bigger scale, and again, the Doctor Society will throw me out for saying this, but we have to find a way to make healthcare something that we all have, that doesn't run out after you've spent a certain amount of money. Because, sometimes, 6 months or an operation cures your cancer and you can sort of begin to move to the survivorship part. But sometimes it's years worth of treatment that costs millions of dollars. And we just have to find a way to solve our healthcare problem on a large scale, on a governmental scale, which may be beyond the scope of what we're talking about. But until we do that, we're going to continue to face major problems.
Yeah, absolutely right, Greg. It's like we can do everything we can together, but that is really the underlying truth of this entire problem. It's really important. The other thing, and Greg, maybe you can shed some light on this, that we've heard from our families is that there's inconsistency as it relates to access to patient support staff like social workers or nurse navigators across the country. And many patients who might want to talk about their finances are unable to because there's no space to have that conversation in the clinical setting. So that to me feels like a barrier, as well as making sure that there's equitable access to even starting that conversation across the board, because right now it seems it's happening in specific places with staff who's maybe more focused on that, like your team, it sounds like, Greg.
Let's see, I think I'm unmuted. Yeah, I mean, I think that is a real problem. I'm very, very fortunate in our breast care center, which I'm the director of. We've got a number of breast nurse navigators, which again is my focus. And so my patients really have great resources, and thank God for these wonderful people, because my patients ask me what's available, and I go, I don't know, but I know someone who does, and so I can turn to them. But yeah, there are certainly many, many places, both smaller and larger than where I'm at, who don't have that, and I think that's an issue. Another issue, and you touched on this, is just that patients are very reluctant to say what they need. I experienced this with my personal cancer experience, and it wasn't financial. I was okay financially, but emotionally, I really struggled. But I felt somehow that I should be able to handle this because I tell people they have cancer all the time, and just because I had it, why can't I handle it? So there's a real reluctance amongst patients to say, I need help me. And one of the things that I spend some time doing with a new diagnosis breast cancer patient is talking to them about how important it is to build a team of people to be your support, because there are going to be all of these things that come up that you don't expect, like the day you are ready to go for your chemo and the car won't start. So who can I call on a Thursday morning when my car won't start? Or who can I call on a Tuesday morning, because they may not be the same person. So one of the things from my personal experience, making mistakes myself, that I spend time with is asking people to build a team and encouraging them to say, I'm struggling with this. Give them permission to say that, because I think a lot of patients just don't want to do that.
Yeah, I love that. And I think that is a nice segue into starting to talk about solutions a little bit, unless anybody else has any other barriers or hurdles or experiences they want to share before we dive into problem solving? Okay. So, so we're talking about the barriers that we've identified, just to summarize, are kind of donor retention and sustainability to meet this need. Really awareness, I think, is a key theme. Awareness of the financial burden, awareness that it's not your fault, that you're not alone, and that you can ask for help. So wiping out the shame associated with asking for help. And I think for the sake of this conversation, you know, focused on the financial side, but Greg, I think you're absolutely right. It's about asking for help across the board. Navigating a broken system. So there's a lot of duplication of efforts. There's competition. So where can we choose collaboration over competition? And then finally, equity and access to resources. So just making sure that no matter where you are in treatment or which nonprofit you're connected with or who your family and support system might be, how can we make sure that everybody has access to the resources that we continue to develop together? So with those kind of hurdles in mind, let's transition and start thinking about solutions. And Greg, I really liked that concept of building a team who can encourage you to ask for help, to support you. And I wonder, is there a way that we as professionals who develop and offer services to patients can kind of formalize this concept of putting support structures in place around a patient so that from day one, they know that that there's someone there to talk to them and to empower them to ask for help?
Yeah, I mean, I don't know exactly how that gets done because I think people like me need educated. You know, it's so easy to, as a physician, be focused on fixing the disease, which obviously is, you know, the number one thing. You gotta take care of the disease, and you've got to deal with that. So these other things get lost in the shuffle. And again, you know, thank God not everybody has gone through a personal cancer experience that may shove them the direction that I got shoved to thinking about some of these things and making it a part of what I do. So we need to, I think one step is we need to educate providers about how important this is. So, and again, I'm not very good at being the guy who does the judo flip and figures these things out. I see what the problems are because I'm aware acutely of my barriers that I face with my patients and that they face. So that would be one. Number two would be, again, just one of the things that I keep thinking over and over again, and I don't have any idea how to do this, maybe you guys can help me find a way to do this in my community, is how do I get these organizations that are providing help together as a group so we can sit down and say, how can we do this better here in my community? Because again, I don't know that I can solve Ohio or the United States, and certainly not the world, but maybe I can solve some problems in Canton, Ohio, where I live, by bringing these people together. But I don't even know how to do that. So maybe some of you who are in that space could give me ideas about what kind of thing could be organized that would interest you in being a part of it, you know, to solve this kind of problem of duplication of services and competition. Because again, I think we're all doing good work. Everybody here wants to do the right thing. But, you know, as I think Pamela pointed out, the donor dollars aren't as good as they were. Times are tough. And so everybody's competing for this. How can we stop competing and start cooperating? And I don't know how to do that. Again, hopefully maybe someone can help me, because it's something that tugs at me. It feels like something that needs to be done in my community, because I've encountered all these wonderful people doing wonderful work, and I think, boy, if we just work together, we could do it better.
On the education part, just because, I just saw the other day, I got to take ethics again for my CPA, CPE, continuing education. Is there a way, I don't know what it's like for a physician in this continuing education world, but is there something that could be mandatory for physicians to take a course on learning how to get better with patient care that we could implement, or just make it a part of the curriculum where we can put it out there for the physicians to take for their continuing education? So that was just something that came to mind to get the word out for the physicians as far as working together as a foundation. I know that we are, doing that now, but but I think starting with the physician in a continuing education world could be the way to get the word out, and probably make it mandatory for the physicians to have their curriculums.
Yeah, that's one thing, Tracy, that we've been thinking about at Family Reach is we do a lot of training of HCPs across the country, but it's not formalized. So over the past few weeks, we've trained a few hundred social workers, which is so exciting, on our financial treatment program, but it's completely voluntary. And so there's been inconsistent kind of presence from our partner hospitals across the country. And so we're starting to think about what steps can we take to move towards more of that mandatory model. And is it, I wonder, do we need to get certified to provide continuing medical education credits, and what does that look like? I'm not sure if anybody here has experience with that, but that is one thing that we're starting to toy with, is how do we offer those credits to healthcare professionals so that they're more enticed to come and do the trainings with us.
Yeah, there are certainly organizations that do that. As this was being talked about, it struck me that by the time you get to my point in my career, it may be too late. And one of the places that perhaps some of that mandatory training is because you're a captive audience is in medical school. And, there are a limited number of medical schools in this country. It's hard to reach every practitioner, but maybe you can reach every medical school and say, we've identified this problem that, again, physicians focus on the disease, and one of the things they also need to think about is what impact is this disease having on the patient, emotionally, financially, etc. And teaching students at the medical student level that this is an important part of the conversation that you have to have with your patients. And so maybe that's a place to focus the education as opposed to continuing medical education. Fine to put it there too. And there are lots of institutions, most hospitals, we all have CME programs that we put on internally. And so it's pretty easy to get credit for educational programs like that if you just ask your hospital contacts who runs your CME programs. They'll put you in touch with those, and they can help you develop a program that meets the criteria. There are certain criteria that you have to meet to be a CME eligible program, but they're fairly simple. It's just a matter of outlining goals, evaluating the program afterwards, things like that can allow you to get CME credit for programs. And so again, if any of you folks wanted to do that, just make contact with your hospitals and they can get you the credit that you need to do that.
Two things I want to talk on is, we work directly with the social workers. And so the social workers are in the hospitals getting the request and then sending them to us. Now, before we were also in the halls every week, every day sometimes. But now with COVID, obviously, we've worked with the social workers more than ever. And the conversation has been great with them, that they have come to us so much and said, we didn't realize how much you did and how much of an impact you were for our families. And so with COVID, we know some of our, needs have gone up with our families, but we also just have noticed that the social workers have been reaching out to us. I mean, almost triple the amount of times before, because they just really see what we do now and through a different lens, since they're our hands and feet now on that hospital floor. So that relationship has really solidified during this time. And then to the collaboration point, we have loved being a part of the Solution Grants family. And I know Livestrong just wrote a blog post about our collaboration with HopeCam. And so that was a scenario out of our San Antonio hospital where the social workers came to me and said, we desperately need iPads for the kids in the hospital rooms, in the inpatient stay, and their bone marrow transplant. So their kiddos are there for a really long time. And we need it for school reasons and social reasons, et cetera. And, I was kind of spinning my wheels trying to come up with money. I was thinking for 2 iPads at the max, just because we are doing a lot of food insecurity requests right now. And so this was an unexpected one. But then we started thinking outside of the box, and we said, okay, who do we really know with technology access? And we reached out to HopeCam, and they, I think, are giving them 15 iPads. Just outside of anything that we could have done. So that was just a beautiful point of collaboration. And we're so thankful that, we are working with different nonprofits. And, like you mentioned, Greg, the competition is, does feel real sometimes, that people, do want that, but we definitely don't. We say this is what we do well. And we know that we have a, specific amount of money, but we always want to be able to say yes to the families. And so we definitely collaborate a lot with different organizations in the area, reaching out to businesses weekly, that they want to fulfill a specific ask for a family. So collaboration is key. And I think the more we collaborate, the more families that we get to help. And that's our main goal.
How aware are small nonprofits? How aware are you of other small nonprofits in your area? I mean, is that something that most people who are in that area, do you know each other? I mean, is that common?
Yeah, absolutely. We know each other just because our worlds are pretty small down here, just in the community. You see each other on the halls, or you see their names being recognized in different ways. And so we definitely take the approach that we want to reach out. Again, our main focus is getting help to the families. And if that comes through us, then great. But if it comes through somebody else, then we celebrate that as well. And so never, would we want that just tied to us. But yeah, I would say I know every person in the Austin, San Antonio area, or know of them that are providing services to the families. And I reach out to them on a fairly consistent basis of, hey, how are you doing during this time? What are y'all doing? This is what we're doing. But I think that's just a mindset that we have of really helping, the families. So.
It's funny because I hear you talk about being in the halls, and honestly, maybe it happens, because I suppose if you were walking down the hall of my hospital, I wouldn't know who you were. So maybe that is happening in my hospital, but if it is, I'm not aware of that. And God bless our social workers. They are the teachers of the healthcare system. They are woefully underpaid and incredibly overworked, at least in my institution. I mean, it's just awful how much work they have to do with so little resource. Uh, but I guess, maybe the problem that I think exists where we don't communicate, maybe it happens and I'm just not aware of it. So maybe there's more of that in the nonprofit world than I know about.
Pamela, I'm curious, outside of meeting in halls, are there more formalized societies or groups of nonprofits that get together on a regular basis or in a forum to talk about their shared needs outside of your experience in the Solution Grants program?
Yeah, I mean, I can only speak to Austin. We have several Facebook groups. One of the ladies that runs one of them is Community Helping Hands of Austin. And so she puts out requests for different nonprofits that she's partnered with. And so we definitely, and they're all, I mean, there's animals, foster care, it's not just cancer, but we work together, within that field, and that brings all of the Austin nonprofits together. I'm not a participant, nor do I know of like a specific cancer nonprofit, gathering or conversation. I would love to know about that, and work within that. But as far as I know, it's just nonprofits in general that, and it's mainly through Facebook groups.
Like a grassroots effort more so.
Yeah, absolutely.
We launched last year a collaborative called the LIFT Network, and LIFT stands for Eliminating Financial Toxicity. We didn't really think through the conflict with Lyft, the rideshare company, but we have currently 10 nonprofits across the country who do this work in financial support, and we've streamlined, everyone's using the same application system, and everybody's also offering the wraparound services that we offer, like financial planning and resource navigation with the direct financial support. So we're small for now. We have 10 organizations. Pamela would love to talk to you guys about Big Love potentially joining us. But it's been amazing what has happened when the leaders of these organizations come together, especially since COVID hit. We've had a number of CEO, executive director roundtables where all of our leaders have come together to brainstorm and talk about fundraising challenges. We've had a few of our members actually secure grants based on their collaboration with us because we're enabling them to kind of relieve some of their overhead costs. So we're trying. I think a major challenge that we have is simply awareness, and making sure that we're reaching the right groups. And then when we do reach with the groups, it's sustainability, and folks are prioritizing different things right now because of COVID, but I think we're getting there.
I also have found, for those based in Austin, I live here, I give here, has a great network and Facebook group, and I constantly am seeing some back and forth on their Facebook between nonprofits swapping ideas and working together. So I know sometimes I feel like I always see the animal nonprofits on there, but the more we can represent the cancer community, I think the better.
Yes, we're a part of that, and yes, I will make a post. I will take that as a charge.
So we've talked a lot about, oh, sorry, Michael, were you gonna?
Oh, yeah, I didn't know, just a quick side note. It might be more of a question than an answer, but I think in the back of my mind, I've always thought about how to bring in more tech solutions to kind of the questions that have been brought up. And so I don't know if there's a system or a for-profit leader that already has something in place to where we could get to Greg's point earlier, medical professionals on the same platform as a nonprofit in the event space, even social workers. And I know, there's different Facebook groups and a lot of different social media outlets to where this is possible, but making it on maybe a local level so we can all kind of talk to each other from that full scale medical professional side, nonprofit side, and even a national level, just kind of like what you were saying earlier with Lyft. I don't know how that works or where, the question even starts, but that's kind of just been ringing in the back of my mind.
Yeah, I think that's critical that we, these are really good ideas and we have to think about the technology so that we can scale them. So it's a really good question, Michael.
Yeah, I agree, Michael. That would be so nice to have a resource, an app I could open that said, I have a patient who's having problems with hunger, and here are organizations that can help me with that patient. That would just be so incredibly valuable.
Yeah, I totally agree with that also, because as Greg was saying too, is like we need to take care of that patient like as soon as they come in and their diagnosis. And if there's like a blog or technology where they can just jump on and say, I can get resources, I can get resources here, I can get resources there, instead of every time they have to go in explaining their story to every individual, every person all over again, gets to the point where they get frustrated. And that's what I've been hearing from the clients that come in to take our program, because there's an opportunity for them to talk here at the Y and go through their woes, their good days and their bad days, and for us to be able to say, okay, you can go on this site and look for food if you need food or help with rent. That's definitely an area where I see a lot of frustration, and they're tired individuals, and so for them to be able to just either jump on a site or make one phone call to kind of direct them to where their needs are would be so wonderful.
It would be cool too to see it come from maybe the portal has a provider portal and a patient portal, so that it's accessible to both. And you probably have different needs if you're accessing it as a provider versus a patient, where you could build out a profile, and then instead of having to explain your story every time, it's already there. And as you reach out for help to any of the organizations, and what I'm imagining as a directory or something, it's already automatic. They can see it.
Yeah, I think that's, I was thinking in terms of something I could look at, but you're right, getting the patient's direct access to that. And it even helps with one of the other big problems with it, which is the stigma of asking for help. Here in America, that's a sign of weakness that you need help. And again, a relatively educated person like myself, I suffered that. I felt like I shouldn't have to ask for help. And it was the worst mistake I made in my cancer journey. I struggled, I hurt myself, I hurt the people who loved me. And, we just have to find a way to say it's okay to need help. And the anonymity of having an app you can open and go to, and, you don't have to tell somebody else, I need help, can you get me some? You can go find it yourself. That would be really great.
Yeah, I love that, Carly. And I would also add, a provider portal, a patient portal, but then when you think about the role that Big Love is playing and that the YMCAs are playing, also like a community organization portal, because there's many stakeholders who represent these patients. And I think patients need all the help that they can get in terms of people who will advocate for them and do the work. So maybe having that third perspective too would help drive it even further forward.
Absolutely. And that would keep, the available resources in their communities up to date if, the individual organizations were responsible for updating their own services and capacity. So.
Do you think a concept like this could help us with the challenge around fundraising and sustainability? I feel like that is kind of where the rubber meets the road when we talk to nonprofits about true collaboration. If we are raising money for a platform that we're building together, where does the money go? Whose patients does it support? Curious if anybody has experience with that angle here, and what are some of the ways we might overcome those challenges?
I really wish I was tech savvy because I want to make this app like yesterday. That all sounds amazing. To your point, Rosie, I think finding the donors and bringing on the people that would be patient-centered focused and not nonprofit centered, like that they're not attached to our money can only go to Big Love, and there are some people, like that. But if you really created a global, more, we're doing this to really focus on the patient and their family, and your resources may go to a variety of nonprofits, and being transparent in that, it's definitely something, as a donor myself to different things, that I think I would look at and be like, yes, that's amazing. I mean, that's what we're here for. So yeah, I think just transparency of what it is, and really realizing that it's not to support a specific nonprofit, but really to support the patient and family.
Because that's what I was going to say too. The money can follow the patient. So wherever the patient's needs are, that's where the delivery service would go, or the dollars would go. So if it's hospital or doctors or organizations or nonprofits, food, rent, like I think the money should follow the patient.
I will say from my experience at Livestrong for the Solution Grants program, for example, I think there's also a level of trust that donors are giving us to make sure that, like the best of the best nonprofits that, have met internal review standards and are helping a lot of people, we're able to, as an organization, evaluate that and give grants out based on that. So I think trust is a big component of that. And how do you establish trust within an app like this to ensure that if you are giving to a general fund as a donor, how do you know that your dollar has impact? How are you reporting back on that? And I think Tracy, I see you unmuted yourself, and I'm glad, because I feel like you could speak to that too.
Well, and I was just about to mention that as well. It's kind of like the GoFundMe page, I'm least likely to give to one of those because you just don't know if that person truly is a cancer patient. And so, being the one to be the initiator of a GoFundMe page hosted by Livestrong or YMCA or Big Love, I think that would be more likely to get the attention that they need. And I will say that, Livestrong is, looking into something in this development. So hopefully we'll see something soon in this.
I think too, on the the fundraising side and the intersectionality of the work we're doing, even if it's a potential small commitment of several different nonprofits of, let's say, $5,000 to $10,000 for 1 to 2 years for this application, if you're looking for this funding, or knowing that attaching that ratio to the impact we could have on a national and global scale, I think could be key, versus just saying you have to fundraise for this event for this amount of dollars. Just trying to make that small ask, kind of just at a whole scale, to get the process started. And even if it's as small as volunteering at another local nonprofit for one of their events, to kind of just get the lay of the land of what they're doing in their space, to get the conversation started, to where when we come together, potentially, if that event was to happen in person or virtually, it would be a little more cohesive and seamless there.
Absolutely. We've gone through a lot of great ideas, and I know we're getting down to our last few minutes here together. So we've talked a lot about collaboration in the nonprofit space and the need for technology to do that. We've identified maybe we need to, within this technology that we develop, create space where a patient tells their story once instead of multiple times, every time they meet a new nonprofit, every time they meet a new healthcare provider on their cancer care team. And as we're developing this, to really make sure that the messaging to donors is empowering around supporting the patient, not necessarily supporting a nonprofit. And I think we've also talked a lot about how nonprofits inherently want to collaborate, right? And they might want to participate in a platform like this. I still wonder, and I'd be curious to hear your perspective about the underlying, once the funding comes in, maybe the donors can be patient-centric, but then how does it balance out among the nonprofits? And I say this because through the LIFT network, we have had some members say to us, well, you're Family Reach, you're a national organization, you guys should just cover all of our costs. But of course, we know that that's not possible because we're all, trying to support patients and have our own programs to run. So are there ways that we can also streamline those operational costs for the nonprofits so that we can eliminate that concern about where does the money flow, and am I still going to be able to keep my doors open as a nonprofit if I participate in this platform?
Yeah, that's such a huge question because just like every business runs itself differently, I feel like a lot of nonprofits run themselves differently. We keep our admin cost super duper low. And I mean, one thing is we don't have a brick and mortar building. And the reason we've done that is just because that money can get to the patients, we feel like, and we can say more yeses. And we have a chronic yes syndrome over here, where when there's big ask, we always say yes, and then we go find the money or the donation to make it happen. So again, it would have to be a like-minded synergy amongst the nonprofits that do gather. That yes, there would kind of, I don't know, almost have to be maybe a general fund of operational cost. And that would have to be decided on in a business plan, and then you figure out all of your program cost from that.
And I would visualize something more like a WeWorks, where you have a space and everything's included, like copier, conference room. I don't know if you guys experienced anything like that, but I think that people that are trying to save cost in the admin and worrying about, do we have enough supplies, having a collaboration of nonprofits being in the same space, maybe not full time, but when you do want to meet with people, that's how I visualize that collaboration.
Yeah, we have this wonderful arts community where I live, and there are these artist collaboratives where they work together in big warehouse spaces, and you have 10 artists who share the space, and people they'll have events, and people will come in and they'll show an interest in something, and maybe that artist kind of doesn't do that, but they can point over there and say, go over to this guy, that's what you're looking for. And they also share resources. It's like, you need a piece of wood to finish your sculpture. Well, that guy's got some scrap that you can use. And I guess what I envision is some kind of cancer collaborative, where if you bring all the organizations together, there may be a couple of organizations that look at each other and go, we're doing the same thing. We could double our impact if we work together and become, maybe two organizations cease to exist and become one, because they can find ways to use the resources that they have better and more efficiently together. And then, we all know that sometimes you're working with someone on a problem and they bring up another problem that's kind of not in your wheelhouse. But if you have this collaborative, you can go, yeah, here's who we need to get you in touch with to deal with that. So I guess that's what I kind of envision when I think of this.
think too, kind of just brought up that I think the more, kind of hands on deck, the more powerful the message could be potentially if, this platform or the larger nonprofits combined with smaller nonprofits come together, could probably leverage a little bit more of a stronger ask to different corporate sponsorships and partnerships that would want to also get in on the ground floor, maybe to help out a smaller operational budget for a smaller nonprofit on a sliding scale to kind of write off those initial costs.
Yeah.
Writing off that, Michael, I do think that, from the corporate perspective, knowing that as a collaborative, it is a trusted group of nonprofits. If they are looking for an organization to support, the groundwork of having vetted is already complete. And so they'll probably feel really good about making an investment, maybe in a smaller nonprofit that they would have not considered initially. So showing them exactly where their dollars are going as far as social impact, I think would be really convincing to me as a corporation.
Well, even as I used to work for a private foundation, and we wouldn't give grants to people if we knew it covered more than, 10 or 20% of their operations. So collaborating would definitely help, I think, people funding the foundation rather than trying to do it in smaller foundations.
Yeah, so many benefits to collaboration that we're identifying. And I think we're also, your comments, Tracy and Greg, are also a really good reminder that we can look outside to learn. Like, we work in arts communities. So we're just coming up on our last minute here, but I'm really grateful for the time. I think we've identified a really good pathway from starting with educating healthcare providers to then ensuring that they actually have access to the resources so that the healthcare providers feel empowered to have the conversation, doing that through something like an app, the technology, and then finally building the story for these nonprofits to come together. I know there's a lot more work to be done, but I think this is a really good starting place and roadmap, and I'm excited to continue the conversation with you guys through Livestrong and all of these great conversations you're hosting. So thank you all so much, and I think that's it for us, and enjoy the rest of the conference.